Victoria Macdonald, you're our health and social care editor. Today we're going to talk about the NHS in crisis. What are you going to tell me?
I'm going to tell you that this is an NHS not just in crisis, but in what one person described to me as a polycrisis across the whole system, from GPs to hospitals to mental health to social care. We are seeing staff shortages. We are seeing record numbers of patients, record numbers of elderly patients too. We've got the problems of COVID and flu combined with pneumonias that are just placing incredible pressure on an already stretched system.
We've read all the papers and seen the headlines. We know that the NHS is, quote, in crisis. And there are a whole host of facts and figures about that. I mean, what figures at the moment in terms of that crisis really jump out at you?
The NHS isn't just in a crisis, it's in a polycrisis. Mm-hmm. It's across trust hospitals, mental health, primary care, social care. Every part of the system is stretched to breaking point. The figures that stand out are the ambulance handover waiting times, the length of time that patients are having to wait in A&E, the number of patients who are having to wait on waiting lists for elective surgery. I mean, every bit of it, cancer treatments that are delayed, you name it. There's almost nothing that it doesn't have a long waiting time attached to it now.
The Royal College of Emergency Medicine has claimed that the crisis is now so acute that it's caused hundreds of excess deaths every week.
Well, that is their claim, and I've seen some very good statistical analysis of it to show that they are in the right ballpark. This was denied by NHS England, who said that it was much more complex than that, but subsequently the Royal College of Emergency Medicine and others have come back and said yes, because if you have to wait in an ambulance to be handed over into the emergency department and you've had a heart attack or a stroke, that is inevitably going to have consequences. Every hour of waiting time is going to cause further problems for those who are truly sick. And then we don't know really what happens once they're getting into hospital. There's all the issues with the low staffing numbers, particularly low numbers of nurses. So yes, probably in that ballpark.
If that excess deaths was true, or it was somewhere near that, how much of an outlier really is that in terms of all the countless crises that you've seen in your reporting over the years? You know, there's always, winter's always a difficult time. How extreme is it?
Well, it feels extreme. Mm-hmm. And it goes back to my first answer, which is it is a crisis across the whole health and care system. Data collection is so good these days that you can drill down into it. And of course, there have been other winters where there have been excess flu deaths, for instance. But this is the first winter where we've had flu and COVID, and we've been seeing other issues with things like streptococcus A, although I'm not sure quite how much strain that's putting on the health service, as well as all the other things like shortage of staff. So it's that combination of things coming together that are likely to be causing these excess deaths.
And is it too simplistic to say it starts way back at the beginning where, the waiting times for people to see their GP is so long that therefore means, they wait a month or more, which means that when they then get possibly referred to A&E, do you know what I mean? It goes along the system, and because you're not seeing that first point of contact early enough, it's letting all these other problems build up, and eventually people have to be treated in hospital, which is where, the most resources and the most expense for the NHS is.
It's partly it is not being able to see the GP, but it's more complex than that. 25% of cancers are detected in the emergency department anyway. So people are quite slow at going to see GPs full stop about their problems. But yes, in some areas, not in all, in some areas, it's hard for people to get in to see their GPs. And then you get to the emergency department and you have to wait hour upon hour. The ambulance doesn't turn up to pick you up, for hours. All of those things brought together.
You've been reporting, obviously, on the health system for a number of years. and you said that this winter it feels like it's a really difficult one. And you've been to, for example, recently Warwick Hospital's A&E. I mean, what did you see there in terms of how you saw, all those stats, all those stories actually in real life?
Well, the interesting thing about Warwick Hospital was when we were filming there, it was on the ambulance strike day.
Mm-hmm.
So typically it should have been a bit more quiet. It didn't feel quiet to me.
Mm.
Certainly they weren't getting the ambulance drop-offs, but the place was still full. There were lots of kids in the paediatric department. It was just busy, busy, busy. And you thought, well, if it hadn't been an ambulance strike day, I just don't know how much worse it could have looked. This is the room with the data, and it was only 8:30 in the morning and they were overstretched.
We can see we've got 2 out of 3 resus cubicles, so we have a resus cubicle available should we need it. We've got nothing currently in minors. We've got 19 out of 20 majors cubicles, so we know that we're under pressure in majors already, which is where the ambulances tend to come. And we've got 8 in our majors waiting room and our corridor.
I don't even know how you keep it flowing if it's like that. I feel exhausted for you. And it's 8:25 in the morning.
There's often people who talk about it being a bureaucracy, but it is a very flexible system, isn't it, that can adapt and finds ways to deal with these numbers of people. Is that what you saw at Warwick?
Well, Warwick, like many other hospitals, has an incredible number of things going on behind the scenes to try and alleviate those pressures. So, for instance, we saw a pilot project for teaching people to have intravenous antibiotics at home. So sometimes somebody might need to be on IV antibiotics for 6-8 weeks, sometimes even up to a year. And that, of course, can take up a hospital bed. So they had got these patients out and into their homes and taught them or their carers how to deal with this. So that was just one little way of trying to take some of the pressure off. The thing that always strikes me about the NHS is we talk about it being at breaking point. And yes, it doesn't ever break, but that's because of the goodwill of the staff mainly. Mm-hmm. It's because people will go over and above what they are expected to do. Often, I see lots of young doctors writing about how they're 3-4 hours over their shift and they're still there and they're still writing up notes or still seeing patients. There is so much goodwill in the NHS. And I've always thought that that's what stops it from, well, it will never collapse, but from becoming way worse than it could be.
When you were at Warwick Hospital, how did the patients respond? Because obviously there are lots of reports about faith in the NHS and it being able to work sort of diminishing. But there are polls which also say the minute face-to-face with the NHS, their satisfaction with it is very high. So is that what you saw at Warwick?
Oh, all the time, always, not just Warwick. I mean, really? In November, we were in Rotherham, and there I spoke to a patient who had been on a trolley for more than 12 hours by the time I spoke to her. And she said, yeah, no, I am in a bit of pain, but she said, but it's the NHS and we're lucky to have it. At Warwick, I spoke to 2 patients who completely unprompted had said, this gives me a chance to say how much I love the NHS. I mean, I hadn't asked, what do you think of the NHS? They just said, while I'm talking to you, I want to say, I have had really good treatment. Sure, I'm in a cubicle and sure, I've been here for 6 hours, but I've been seen by a lot of people, a consultant's coming along at any moment now. I am in good hands.
I have been seen by a large number of people. I'm due to be seen by a consultant now. It gives me an opportunity of saying that the treatment that I've received in this hospital now and previously, first class.
And talking about the staff, we have seen these unprecedented strikes from nurses, ambulance workers, etc. There's a broad range of disciplines striking, but are they all sort of coming at it with a common message?
It's about pay, yes, different aspects of pay, but essentially, of course, they're wanting more. In the case of junior doctors who are currently being balloted, it's about reversing cutback in their pay. The same with nurses, actually. Their pay has fallen in real terms. And then there are also the staffing issues. So every time the unions have gone to meet with the health secretary, and I think there have been about 3 meetings so far, at least the first 2 meetings, the health secretary would only talk about productivity and staffing and not pay. But the unions have been very explicit that all of it needs to be put together. Yes, the pay needs to be dealt with, but so does there need to be a proper staffing plan, which we haven't seen. And, how are you going to deal with all of that put together and keep the staff wanting to stay in the NHS? Because at the moment, there are very, very big gaps.
I guess some critics would say the concern is that when these strikes happen, that puts people's lives at risk. I mean, what's the response from those who strike?
Well, some people, the government in particular, has claimed that lives have been put at risk. I can't answer that, but there isn't any evidence. Certainly in the first ambulance strike in December, we saw ambulance workers leaving the picket lines to treat desperately ill people. In Warwick, for instance, they were still answering Category 1 and Category 2 calls, so heart attack, stroke, life-threatening. They were being dealt with anyway. Some of the patient transport was still being provided for those who had emergency cancer treatments or needed dialysis. And remarkably, or maybe expectedly perhaps, calls from the public, the 999 calls from the public, went down by more than 20%. So the public themselves were being reasonably responsible about how they were making those emergency calls. Of course, what I don't know, although we will find out probably in about a week, is what the knock-on effect was for the next couple of days after the strikes.
There's a potential for more strikes. Do you get a sense at all, if there's an end in sight, whether the government's willing to move on this?
There are lots of reports that Steve Barclay, the Health and Social Care Secretary, has moved somewhat towards the idea that there needs to be some sort of settlement. Now, what that settlement would be is not clear. There have been talks about a one-off payment or backdated payments, but has moved towards the idea that something needs to give, but is up against, apparently, the Treasury and Number 10. So he is reported to have said at last week's meeting with the health unions, you help me make the case to the Treasury that we should be paying this. I mean, if that's true, that's a very powerful lobby. But at the moment, we're not seeing any movement from the Treasury or Number 10 on this.
So, Victoria, let's try and discuss about how we got here. I mean, in the short term, the government would put forward this idea that this is to do with the backlog in appointments, surgical procedures, treatment after the COVID lockdowns.
We've seen significant pressure on the NHS, particularly over this period, through a combination of very high rates of flu, persistent and high levels of COVID, continuing concerns, particularly amongst many parents around strep A. And that has combined over that period with a time when primary care services and community services are also much more limited. So that surge in flu and COVID cases has put massive pressure in terms of the NHS services.
Is that fair to say that this is wholly, perhaps, or is it just partly what happened because of the 3 lockdowns we went through?
No, that's really not fair. This was happening well before COVID. The waiting lists were growing. COVID did not help by any stretch of the imagination, but this was happening, and it's to do with the way the NHS has been funded over the past decade or so, because funding has gone down, and the consequences of reduced funding are that you are going to get backlogs and you're going to get staffing issues. Now, the government has put in more money recently into the NHS, but it is not enough to cover what happened before, sort of towards the end of the Labour term and the beginnings of the Conservative government and what's happened subsequently.
And I guess in some ways, that sort of amnesia some people have about COVID also means that we forget NHS staff a bit more pay to say thank you for what happened.
Yeah, the clapping for carers has come up quite a lot on the picket lines. It's people saying, yeah, well, you did that then, and what are you doing now? You've certainly stopped clapping for us now. There's quite a lot of bitterness about that. I mean, there was a degree of unhappiness at the time about this clapping for carers, because they're like, sure, you're going to stand on the steps of Downing Street and clap for us, but are you going to give us more money? Are you going to give us, at the time, PPE, all of those things? But right now, it's the irony is not lost on a lot of health workers.
Is it simply to say that ever since in the last 12, 13 years with austerity, this has become about austerity and its impact on the NHS over time?
Yes, a lot of people would argue that because, of course, everything that's happening or most things that are happening in the health service can be judged from the community that they've come from, in a way. So if you've got cutbacks in public health, if you've got poor housing, if you've got problems in the education system, if you've got kids on free school meals, all of those things build into a pressure on the health service because you have sicker people. And a lot of people would argue that with austerity that there were many people who fell through the gap, and the consequences are ill health and disability. But what we haven't even talked about is social care. So if there are 13,000 patients a day in England, in hospital, when they could be moved out, when they're well enough to go back into the community, and they can't because there aren't places for them in the community, in care homes or back into their own home. And that's because not enough money's gone into social care. And that has a direct and obvious impact on the health service, along with poor housing stock, along with poverty in the communities, all of those things that impact. But we keep looking at hospitals because that's the most obvious sign of where the pressure is. But actually the pressures are all down, further back down the chain, if you like.
I know that Amanda Pritchard said, Chief Executive of NHS England, that the NHS had not planned for the long term, and especially on staffing, it was now over-reliant on foreign-born doctors and nurses.
Yeah, well, that's another issue again, is that there has been quite a lot of criticism of successive governments failing to have enough medical school places, enough places in nursing, enough social care, training, all of that. And these are things that take, years, that you need to plan ahead for years to get the right numbers. And the UK has often relied on medical staff from abroad. And of course, some of that was upset by Brexit, some of that was upset by the pandemic, where people raced home and haven't come back. They are increasing the numbers in medical school, but we won't see that, for a long time. Getting rid of the nurses' bursaries had an impact because then people couldn't afford to go into nursing. Some of that's been dealt with to a degree, but it will be a long time.
Looking long term at what needs to be solved, staffing, social care. What about just the fact that we are a growing population and the average person in the UK is now living for much longer than before? Does that also play into it?
Yeah, very much so. I mean, you go into any hospital, you go into any GP waiting room, and you're going to see people who are really quite elderly. But it's not just an upward line. At some stage, the population will start to grow slightly younger again. So it's sort of the trajectory it's on now, yes, because the older you are, the more likely you are to have different health conditions, sometimes multiple health conditions. It's not unusual for me to go into an emergency department filming to have, more than a couple of people over the age of 100 in there. Certainly, the large majority of them are often over the age of 80.
In terms of solutions, if there are any, short-term, long-term, Rishi Sunak has said that he will make cutting NHS waiting lists one of his key pledges.
NHS waiting lists will fall, and people will get the care they need more quickly. Those are the people's priorities. They are your government's priorities, and we will either have achieved them or not. No tricks, no ambiguity. We're either delivering for you or we're not.
What change have we seen from the government, and do we think it's going to have an effect? I know that they've said that they will block buy thousands of care home beds. They're going to have porta cabins in hospital car parks. Are those just quick fixes?
The block buying the care home beds is short term, yes, because that's only literally going to last until March. And it doesn't resolve the fundamental problem of how you get people out of hospital and back into the community. Porta cabins, yes, that is again a sort of winter fix. The waiting lists, well, the waiting lists were already due to come down anyway. There's been a lot of emphasis, particularly on the long waiters. And actually in the last set of figures that just came out last week, which were for December, there was a very small drop in the number of people waiting. So it was sort of, it was an important pledge on the Prime Minister's part, but it was one that he probably will see fulfilled. It doesn't deal with the fundamental issue, that there aren't enough staff. Another thing we haven't talked about is, the capital spending. Actually having hospitals that need a lot of money put into them to try and improve their infrastructure in order to get the flow through better.
And, the Labour Party at the moment is high in the polls. It clearly thinks that it has a good chance of winning the next election, as most commentators think, whenever that may be. Wes Streeting, the Shadow Health Secretary, came out and talked about tearing up the contract with GPs, family doctors being salaried NHS employees, a greater role for pharmacies in giving out vaccinations, for example, even allowing people to refer themselves to specialists rather than going to the GP. What's their thinking there, and what's the reaction been?
Yeah, I wish I could tell you what their thinking was, and I am a little bit perplexed. I don't know why they've taken on the GPs unless their polling is showing them that people are really concerned about not getting face-to-face appointments. But again, that's variable across the country. So actually face-to-face appointments are back up to pre-COVID numbers. And some people say they prefer the phone consultation. So it feels to me as if they came up with this bright idea, and actually over the past few days, there's been such an outcry against it, not just from the people you would expect, like the British Medical Association or the Royal College of GPs, but sort of a number of different places that they really don't need to have this fight. Pharmacists already do vaccinations. And that's actually been a big part of the current government's pledge to take some of the pressure off, is to make much more use of community pharmacists. The Labour leader, Sir Keir Starmer, last weekend was talking about the bureaucracy of the NHS, and he didn't really elaborate on it except to say, for instance, if people could refer themselves for physio appointments or if they had internal bleeding.
So is the argument, therefore, the criticism is that this is a non-solution to not the real problem?
I'm intrigued as to why they've gone for that and not for other parts of the health system. And I would actually like to hear them talking about public health, about preventative medicine, about how they're going to ensure that people are living in safe environments, that aren't filled with mold and damp, that then therefore increase their asthma, that therefore send them to the GP, that therefore send them into the hospitals.
With this talk of the NHS and its most profound crisis in its 75-year history, whether this is an existential crisis in the sense of, does the system itself need reforming to other models in other countries? Do you think that's actually a serious discussion? Or is that just, again, politics?
I would be very surprised if there are too many people who want to get rid of the NHS. There is always a small cohort who thinks that would be better off privatised. Reforming the system is always a government's way of saying, I need to be seen to be doing something. The NHS has gone through a lot of reforms over the past 20 years, and I don't think it needs any more reform personally. Of course, things need to change. It needs to be encouraged to become more innovative. And one of the criticisms I've often had of the NHS is I will go and film an amazing project or, way of doing something in a hospital, and you think, why aren't they doing this right across the NHS? And somehow it never seems to spread out and gain traction elsewhere. I would like to see more sort of sharing of innovation. And I know there are a lot of people who are trying to make that happen. But if you don't have the staff, if you don't have happy and well staff, I mean, it's a moot point, isn't it? You could turn the system on its head, and it's still going to face the same problem. So I think any government really should be dealing with that first and foremost.
In some ways, that's the essence of where we are. That idea of this overstretched staff have just gone through 2 years, if not more, of COVID, and now they're in this crisis. And that really is at the heart of this, is the staff just being pushed and pushed and pushed.
I think so. 3 years of COVID. Yeah, I really think so. And there are a lot of vacancies, and there's a lot of trouble with retention. So you need to lure these people back in and make it a good place to work. Even small things like making it more childcare friendly, or making sure that people are being rewarded, and I don't just mean monetarily, but recognised for their hard work.
Victoria Macdonald, thank you for talking to me.
Thank you.